Doctors who have given a second opinion diagnosis, what is the worst first opinion you've ever encountered? I witnessed firsthand how my grandmother was misdiagnosed. I was living with her at the time when she suddenly became very sick. She couldn't eat or drink, was constantly throwing up, and spent most of her days in bed. I took her to the hospital, where they ran some tests and told us it was just an inflammation in her stomach. They said she'd be fine if she followed a certain diet. She stayed there for a few weeks, then came home, but she never got any better. A few weeks later, our cleaning lady came by, took one look at her, and immediately said she looked yellow. I hadn't noticed. The change had been gradual, and I mostly saw her in the dark, since she was sleeping all day. We took her to a different hospital right away. It was cancer. The first hospital had misdiagnosed her so badly. She had to undergo surgery and spent weeks in the hospital recovering, but by then, she'd become deeply depressed and frustrated. That frustration came out as anger, and she took it out on me. We ended up having a terrible fight on New Year's Eve. I was already struggling with my own mental health, and I completely broke down. The police had to intervene that night after I hurt myself, and I moved out afterward. She passed away 3 days ago. I never spoke to her again after that night. I can't stop wondering, if that first hospital had diagnosed her correctly, maybe she could have gotten the right treatment in time. Maybe all of this could have been prevented. Story 2. Not me, but my mom. She was always exhausted, the kind of exhaustion where she'd take a bath and be so drained that she'd fall asleep on the bath mat afterward. She went to her doctor, who told her, "Oh, you're just depressed. Go get a haircut." She did, still exhausted. She went back to the doctor. Again, she was told she was just depressed, to get a hobby, that it was all in her head, etc. No blood work, no referrals to specialists, nothing. Months later, she returned. Her regular doctor was on vacation, so the covering physician saw her. One look into her eyes, and the doctor said, "It's your liver. Get these blood tests now." Abnormal blood work and a liver biopsy later, she was diagnosed with autoimmune hepatitis and was told she was just 3 months from death. After treatment improved her condition, she went back to her original doctor and said, "I didn't need a haircut." 27 years later, she still suffers from lingering effects. Story 3. I'm a lawyer, but one of my clients was given a devastating diagnosis of an extremely rare heart condition. The doctor told him he had 6 weeks to live. He contacted me to make his will and get his affairs in order. Thankfully, he sought a second opinion with a highly respected cardiologist. Apparently intrigued by the rarity of the condition, there was nothing wrong with him. He was fine. This poor man and his family were tortured by fear and devastation for nothing. He actually called me to tell me the news, still in the joyous, "I'm not going to die" stage. I imagine anger might come later, once he fully processes what he went through. I don't know how a doctor could make such a colossal error, whether it was a test mix-up or some other mistake, and I shudder to think that perhaps someone else, a completely innocent person, is living with a ticking clock they don't even know about. Story 4. When I first started feeling sick one October during college, I had a non-productive cough, night sweats, and trouble sleeping. Some unexplained weight loss. The school nurse gave me Claritin. Over time, all of these symptoms got worse. I became incredibly fatigued, my lymph nodes swelled, and I developed pretty bad backaches. My GP ordered a chest x-ray and prescribed antibiotics for pneumonia. By this point, I was barely managing an hour or 2 of sleep per night and had almost failed out of school. It wasn't until spring break that I saw a pulmonary specialist. He immediately knew it wasn't pneumonia. I had stage 4B Hodgkin's lymphoma. My first PET scan showed cancerous cells in lymph nodes across all 4 quadrants of my body. By then, I had lost about 1/3 of my body weight. The cough, weight loss, and back pain were caused by swollen lymph nodes pressing on my lungs, stomach, and back. After my first round of chemo, I actually felt incredible. I felt so awful before that an IV mixture of carefully measured toxins felt like an improvement. I went home and ate an entire pizza. Chemo got harder as treatment went on, but it worked, so I can't complain too much. Story 5. Not a doctor, but my mom went into a walk-in clinic and told the doctor she had really bad headaches all the time. She was a stay-at-home mom to me, Tane, and my sister, 6, so it was written off as stress, and she was given a prescription for pain pills. 2 weeks later, the headaches turned into migraines. The doctor prescribed a stronger medication and again told her to try to reduce stress. A few weeks after that, she could no longer get out of bed. She was throwing up everything, including her medication, completely disoriented and barely alive. My dad was a truck driver, so he was rarely home. I was taking care of myself, my sister, and my mom all by myself. We went back to the doctor, and this woman had the audacity to call it the weirdest migraine case she'd ever seen. She told my mom to take warm baths and to keep taking the medications even when she vomited them. 2 months went by, and my dad came home. He saw my mother's condition, so sick she was urinating herself, and the state of the house, which was being maintained by a 10-year-old. He said he wanted a divorce. That night, we found out my mom had stage 4 lung and brain cancer, with a tumor the size of an egg pressing on her brain, along with many others scattered throughout her body. I still haven't forgiven that doctor for not taking my mom seriously. Eat it. I figured I'd answer some questions. As for my mom, she fought hard for 2 years, eventually passing in November 2010. I was 13 and my sister was 9. My dad fell out of a tree about a month after her diagnosis, shattering his heel. He became disabled due to the surgeries and back complications. At home, he was a monster. I remember walking on eggshells, being constantly accused of things I didn't do, and being watched like a hawk 24/7. I suspect he is bipolar and has severe PTSD. But older people often refuse treatment for mental illness. Growing up without our mom was incredibly hard. She constantly talked about how she wanted to beat cancer and leave my dad so we could have the life we deserved. Despite everything, I think my sister and I turned out fairly well. I'm now 23, have a family, moved far away from those memories, and am committed to breaking cycles and loving my children the way I wish I had been loved. I do wish I knew the doctor's name now. Even though I know it wouldn't bring my mom back or change her diagnosis, I still want to ask if she ever started believing her patients. Being a stay-at-home mom with a history of poverty, my mom already had so much to deal with. I don't wish her harm, but I haven't forgiven her for not urging my mom to go to the ER. Life is short. I learned that by watching my mom give up on every dream she had because she knew she would die. Go do scary things because who knows what'll happen tomorrow. Story 6. Patient. When I was in college, I went to the doctor because I was pissing razors. The pain progressed rapidly, and by the end of the week, I could barely walk or sleep. The doctor asked me about my intimate life, and I told him the truth. My girlfriend and I had only been with each other for many years. He scoffed at me, insisted it was likely chlamydia, gave me a long condescending lecture about safe intimacy practice, and sent me home. A week later, my urine test came back. It turned out I had the worst bladder infection they'd ever seen. I had to undergo a procedure with a camera inserted into my urethra, multiple rounds of antibiotics, and even now I still struggle to urinate properly due to irreversible damage the infection caused. Story 7. I have one that happened to me. I did college gymnastics, and during my senior year, I had an accident in practice, landing on my neck. I went to the hospital, got x-rays, and was told I was perfectly fine. I walked around in pain for weeks. Eventually, I saw another doctor who ordered a new set of images. That's when I found out my neck was actually broken in 3 places with a dislocation. I had to undergo a multi-level fusion surgery just days later. It turned out my x-rays had been swapped with someone else's in the ER, and I had been diagnosed based on another patient's images. This mistake only came to light when I requested my records long after surgery for insurance purposes and discovered my files contained someone else's medical records and images. Because of the time I spent walking around with the injury, I had to have a posterior surgery instead of an anterior one. It's far more invasive and has left me with major ongoing issues to this day. Story 8. Not a doctor, but I went to a dermatologist for a rash on my hands and face. He insisted it was eczema, even though I had never had eczema in my life. He refused to do any testing or take a biopsy and prescribed a steroid cream for eczema. The rash spread and became horribly worse, covering my arms and face. It was itchy and painful. I went to a different dermatologist and explained the situation. They took a biopsy and discovered it was actually a bacterial infection. The first doctor had essentially worsened a bacterial infection by putting me on steroids. I was a minor at the time, and I still don't know why my parents didn't take action against the first doctor. Story 9. Not a doctor, but my husband almost died due to a misdiagnosis. To give some context, we were young, mid-20s, living in a college town at the time. He was in excruciating pain on the floor on his hands and knees, so we went to the ER. The doctor barely examined him and simply told him to stop drinking, saying he would be fine. The pain worsened, and he began vomiting. As soon as our doctor's offices back home opened, we drove 1.5 hours to see our primary care physician. Within 15 minutes of walking in, he was rushed into emergency surgery. His gallbladder had completely ruptured, and he was going septic. It was a total mess. He almost died, all because of a misdiagnosis. Story 10. Not a doctor, but my sister was about 2 weeks away from giving birth when she suddenly experienced excruciating pain and severe vomiting. I called her midwife, who refused to speak with me, even though my sister was clearly unable to talk, sitting on the floor next to the toilet, crying and vomiting. Finally, my sister took the phone herself and was told by her midwife that it was probably just a virus and that she should eat a popsicle. Eventually, I convinced her to go to the ER. She was immediately rushed into the OR for an emergency C-section. Her placenta had abrupted, and my niece was born not breathing. She suffered several seizures and even briefly died before being resuscitated. My niece is now 15 and has cerebral palsy due to the prolonged oxygen deprivation she suffered at birth. Story 11. Not a doctor, but when I was 11, we suspected I had Lyme disease. My doctor refused to test me because the bullseye rash on my ear was slightly irregular. 6 months later, I started experiencing excruciating hip pain. I was very athletic, but I had to quit all my sports because whenever I tried to run, I would collapse in tears from the pain. When my doctor examined me, he asked my mom, without explaining, what he suspected, what kind of health insurance I had. My mom was alarmed and demanded to know what was wrong. He told her that my leg was calcifying, essentially turning into bone, and that I might need an amputation. We left immediately, switched doctors, and at the new appointment later that week, we insisted on testing for Lyme disease. The test came back positive. My mom has also suffered nerve damage and has experienced numerous misdiagnoses over the years, including MS cancer, and issues with blood vessels in her brain. Story 12. I'm a surgeon. Most patients come to me after seeing another physician who has diagnosed them with something and told them to see a surgeon. I've been called to see multiple patients for appendicitis who had already had an appendectomy. I've also been called in cases where patients very obviously have advanced, previously undiagnosed cancer. By the time I see them, it's far too advanced for me to help. I often wonder, am I being called so I can be the bad guy and explain everything? The answer is yes. Story 13. I had the opposite experience. I'm a midwife and gave a second opinion. The first assessment came from the woman's GP. She came into the antenatal clinic complaining of a headache she couldn't shake. She had called her GP the day before, who told her to take 2 Panadol, have a bath, and that she'd be fine. Whenever a pregnant woman reports a persistent headache, it sets off alarm bells, as it can indicate preeclampsia. Sure enough, she also reported seeing blue spots, had a blood pressure of 221/80, and a huge amount of protein in her urine. I had her lie on her side in the room while I quickly called for a more senior midwife. Within 60 seconds, the two of us returned to the room, just in time to see her start having an eclamptic seizure. We called a code pink, obstetric emergency, which escalated to a code green, alerting theater for an emergency cesarean. She gave birth under general anesthesia 20 minutes later. I still start sweating when I imagine what could have happened if she hadn't come into the clinic that day. Story 14. I recently left a practice, partly because of a case that troubled me deeply. A woman brought her 8-month-old in for a second opinion. The practice owner had previously seen a rapidly enlarging sacral soft tissue mass, which the mother had first noticed about 6 weeks earlier. He told her not to worry about it. When I checked his notes, they simply read, "Plan, ignore." I was shocked. There was a new, rapidly enlarging blue-purple cystic mass on the baby's sacrum. It looked like a small plum under the skin at the top of her buttocks. Without any investigation, my colleague dismissed it. I was appalled, but the mother was relieved to get a second opinion. This wasn't the first instance of questionable judgment I had witnessed, but it was among the worst. I realized I couldn't continue working in a clinic where I couldn't trust my colleagues' judgment and would constantly have to question their decisions. The baby received imaging and was referred to a pediatric surgeon. Unfortunately, I don't know the outcome, as I'm now working elsewhere. Story 15. Obligatory. I'm not a doctor, but when I had my wisdom teeth out, it was pretty brutal. They had to put me completely under, dig deep into my jawbone, and remove teeth that were coming in sideways and upside down. Basically, the worst case scenario. The next couple of days were extremely painful, which I expected, but I noticed a growing hot lump on the side of my jaw. I figured it would go away on its own, but it didn't. My mom noticed it and immediately took me back to the surgeon. The dentist took an x-ray and, without even examining me or asking any questions, said I was fine, probably just scar tissue, and told me to leave. I thought, well, he's smarter than me, so I guess he's right. My mother, however, didn't think so. On our way to get a second opinion, the hard lump in my jaw suddenly burst, and blood and pus leaked everywhere in my mouth. It was horrifying. My mom immediately turned around, drove back to the dental surgeon, and dragged me, still spitting blood and pus, into the office. She insisted the surgeon look at my mouth. The surgeon muttered something about hysterical women seeing things that aren't there, but he prescribed antibiotics and additional pain medication anyway. That's how a 1-2 week recovery turned into an entire month, and I ended up having to drop a college course because I missed so much. Story 16. My mom used to work at a nonprofit clinic that provided free health care to people without insurance. One day, a man came in with his teenage daughter. He explained that he was between jobs, and the insurance from his new job hadn't kicked in yet, but his daughter needed antibiotics for what he assumed was her usual yearly case of pneumonia. He was arrogant and rude, saying things like, "She has a Cuban doctor she usually goes to. My mom is Mexican, and in our area, most Latinos you see are Mexican." My mom stayed calm despite wanting to lose her patience. She examined his daughter and noticed her fingers were clubbed. Clubbed fingers are a sign of a serious chronic respiratory condition, not something temporary like pneumonia. She asked if she could run a few tests just to be safe. At first, he was huffy, but he agreed when my mom explained it wouldn't cost him anything except a little time. A few days later, the clinic called her in a panic. The girl didn't have pneumonia, she had cystic fibrosis. The girl was transferred to a hospital where she could begin proper treatment. It was a minor case at that point, but if it had been worse, she could have been in serious danger. My mom probably extended this girl's life expectancy with her timely diagnosis. Her usual Cuban doctor had been misdiagnosing her with vitamin deficiencies and pneumonia for years. Later, the father called to thank my mom for helping his daughter. Inside, she was thinking, what about her Cuban doctor, huh? But she stayed polite and wished them well. Story 17. This is the opposite scenario, but honestly, the best request for a second opinion came from a CVS Minute clinic. A young, healthy law student went to the Minute clinic, feeling awful with flu symptoms. This was a few years ago, well before COVID. They checked him out. He had a fever, body aches, sore throat, and a positive flu swab. His vitals were mostly normal except for a heart rate of 140, high, but not crazy. Being a young, otherwise healthy guy walking into a CVS, it would have been easy to dismiss, but the Minute Clinic staff said, "Go to the ER, you need an EKG." He followed their advice. At the ER, his chief complaint was, "I have the flu and CVS told me to come here." They did an EKG and discovered he was in slow VT, a life-threatening arrhythmia that required immediate defibrillation. His heart was giant and barely moving. He ended up getting cannulated for ECMO, cardiac bypass life support, within hours. I can't say all Minute clinics are like that, but wow, what a save. Story 18. When I was a kid, a substitute doctor diagnosed me with asthma. Cue the nebulizer and inhaler. I kept saying it felt like there was something in my lungs. A week later, my regular doctor did a chest x-ray, and I had pneumonia the entire time. One more. After a surgery, I vomited so violently that I developed a pseudo-aneurysm near my femoral artery. I instantly knew something was wrong and went into shock. My girlfriend yelled for the nurse, who said, "It's probably nothing." I insisted, "It's something. Get a doctor." The surgeon came in immediately, saw the issue, and started putting pressure on my femoral artery. My memory is foggy due to internal bleeding, but I made it. Had I listened to that nurse, I would have died right there. Story 19. Not a doctor, but it was my own doctor. I was a child and had constant trouble with abdominal pain. My mom kept taking me to the doctor, and he continually minimized it, saying there was nothing wrong. This went on for a long time until one day I doubled over in pain outside school. My mom asked if it was hurting, and I told her it always hurt. I had only ever mentioned it when it was really severe. She immediately took me to the doctor's office and demanded that it be investigated properly, reasoning that a 5-year-old shouldn't be living in constant pain. A few scans later, I was whisked straight into surgery. My mom still can't bear to think about me being wheeled into the operating room when neither she nor the doctors even knew exactly what was wrong or what they were going to do. The plan was to open me up, figure out the problem, and go from there. It turned out I had an extra growth on my kidney, which was completely infected, and an extra ureter that was infected, along its entire length. The doctor, who had repeatedly dismissed my mom as an overreacting parent, claiming her child was perfectly fine, actually ended up making a house visit to apologize. Story 20. I had a period of about a year where I kept getting constant UTIs. Apparently, as a woman in her mid-20s, this is normally caused by not peeing after being intimate. The thing is, I wasn't sexually active at all due to vaginismus, so that clearly wasn't the cause. My doctor was away for school holidays, and I thought I could tough it out until she returned. Nope. 2 days later, I could barely move from the couch because of the pain. I called a home doctor since it was a public holiday. He refused to give me a prescription until I admitted that I was being irresponsible. When I said, "I am a virgin," an embarrassing and potentially dangerous statement to make to a strange man while I was home alone, he laughed and said, "No, you're not. Nobody is at this age. Stop pretending to be innocent." He slammed the prescription on my coffee table and walked out, refusing to provide the starter dose that doctors are required to carry for people who are alone and can't get the medication until the first dose takes effect. I called the office to complain, and he did get reprimanded. But wow, was I ever embarrassed? Story 21. I'm a gynecologist. The number of times I've seen patients who are pregnant and upset, or sometimes thrilled, because another doctor told them they couldn't get pregnant is astounding. Usually, it's a family medicine physician giving the original advice. I'm not criticizing all family doctors, just noting the trend. I then have to explain that even if a patient has a condition that makes pregnancy unlikely, the odds are almost never zero. Maybe less than 1%, but not zero. So, of course, it can happen. Story 22. My grandmother fell from her horse one day. It wasn't a terrible fall, but the way she landed made her worry she jolted her neck or spine. Being older with fragile bones, she wanted to get checked out. Her doctor examined her, gave her one of those soft neck cushions, and sent her home. A couple of days later, she decided to get a second opinion. No particular reason, she just hadn't felt listened to by the first doctor. The second doctor took one look at her x-rays and freaked out. He told her she needed to be immediately fitted with a brace to immobilize her spine. From what I've looked up, it was likely a halo brace, though it seemed even bigger and more metal in my memory. It turned out she had broken her neck, the same type of injury that paralyzed Christopher Reeve, but she wasn't paralyzed because her vertebrae hadn't dislocated. The doctor warned that even a minor fall or twisting the wrong way in bed could have left her permanently paralyzed from the neck down. She wore the intense metal brace for a few months and recovered completely. She lived another 15 years. After that, I often think about that story. The second doctor truly saved her mobility and independence. Story 23. Not a doctor. This happened to my mom about 20 years ago. She was around 36 at the time and had 6 kids. She was experiencing severe abdominal pain, and if my mom admits she's in pain, you know, it's serious. Her family doctor was on vacation, so my dad took her to the emergency room. The ER doctor told her she was constipated and sent her home. The pain worsened, and she returned to the ER a couple of days later. She specifically asked the same doctor if it could be an ectopic pregnancy. He laughed at her and sent her home again. A third trip to the ER brought the same doctor, who accused her of lying to get drugs. She had to wait a week until her family doctor returned. Just over the phone, the family doctor realized something was wrong and told my mom to come in first thing in the morning for tests. Unfortunately, she never made that appointment. During the night, her fallopian tube ruptured. My dad found her unconscious on the floor and rushed her to the hospital. It turned out she was about 10 weeks along with an ectopic pregnancy. The family doctor reportedly screamed at the ER doctor in the hallway over his incompetence. Story 24. Not a doctor, but I ended up getting a second opinion on the doctor I had for 2 years in high school. He diagnosed me and issued medical certificates and prescriptions for pleurisy, twice, glandular fever, shingles, tonsillitis, despite the fact I have no tonsils, and malaria. 5 different diseases in 2 years for an otherwise healthy 16-year-old girl. My teachers would read these medical certificates and say, 2 weeks off for malaria just after recovering from your bout of glandular fever? Very unfortunate. Clearly, they didn't believe a word of it. The shingles case was the most memorable. I specifically told him I had psoriasis, which I'd had for years, and that a rash had just randomly appeared on my ribs. He insisted, no, it's shingles. It's quite rare for someone your age to contract it. He gave me 2 weeks off, so I didn't push back too hard. Looking back, it was clear this guy probably just found a medical license on the street and claimed it as his own. Story 25. She's depressed because of work. No, ma'am, she has schizophrenia. She has borderline personality disorder. Did you mean she's female and insisting there's something wrong when you just want to write her off? Because what she actually has is a brain tumor. Thanks for playing, but goodbye. He has anxiety. He has OCD. I'm not sure how that was missed. It's not subtle. He just took some bad acid. Urine tests say no, and the patient says he doesn't do drugs. I get it. He's a teenager. But unless he took acid 4 months ago, while never being alone in the house. Thanks, lockdown. And it's only affecting him now by pixie magic, I think. What he has is psychosis. I'd like to admit him, please, and thank you. Also, an infinite array of prisoners diagnosed by officers as making it up, when the answer was serious mental illness. There's a reason I got out of that job. Story 26. Obligatory. Not a doctor, but... Before I was born, my father got a call from a neighbor because my brother had gone to get him. Our mother was curled up in a ball on the floor, crying, and unable to stand from the pain. My father rushed home, carried her to the truck, and drove her to the ER. The ER doctor's response? Oh, it's probably nothing. We'll just put her under observation. Meanwhile, my grandparents had arrived, and my grandmother could immediately tell something was seriously wrong. My mother had an insanely high pain tolerance, so for her to be hurting like that was alarming. My grandmother called her doctor, who proceeded to scream down the phone that they needed to get her to another hospital about 20 minutes away, immediately. They did, and she was taken straight into the OR. It was a ruptured ectopic pregnancy. She survived, and family lore has it that it took 4 security guards to drag my father off that ER doctor the next day. A year later, I arrived, which was a whole other story of chaos in itself. Story 27. Not a doctor, but I'm sorry. My mother had severe back pain for a few weeks and already had an MRI scheduled a month later. Then, in addition to the back pain, she started experiencing a tingling sensation in her legs. They drove her to the ER at the largest and supposedly best clinic in town. They told her not to worry and to wait for the MRI. A few days later, she became incontinent. This time, they performed the MRI and found a tumor next to her spinal column. They recommended operating on the tumor and removing parts of it. 2 weeks later. This seemed strange to my parents, and no one really seemed to care about my mother. They decided to switch to another hospital, but by then, about a week had already passed. My mother had an emergency operation that night, but the tumor had already caused lasting nerve damage. Thanks a lot. First hospital. Later, there was another incident. A doctor suspected she had metastatic tumors in her lungs. When the results arrived, another doctor came to speak with my mother. At the same time, she was being visited by my aunt and my cousin with her baby. Without any preparation or counseling, the new doctor told her, "You should say goodbye to your relatives. You won't see them again, as you only have a few weeks left." Later that day, my father consulted the other doctor, who was completely surprised. "No, we already knew there were metastatic tumors, and I already told you how I planned to treat them. That was 2 years ago. My mother is still alive, and the treatment is still working." Unbelievable behavior from that second doctor. Story 28. Nurse here. I cared for a woman who had been diagnosed with broken vertebrae. She was in a lot of pain. Her blood pressure was very low, and she kept losing consciousness. She was extremely difficult to wake. I couldn't get her doctor to answer the phone in the middle of the night. Something about the whole situation felt off. When he finally did answer, he demanded we give her Narcan, insisting that we had overdosed her on narcotics, per his orders. I was then left with a hysterical woman in severe pain, going in and out of consciousness. I finally went down to the hospital entrance and grabbed the cardiologist who had come in at 4:30 a.m. for rounds. I told him, "This isn't your patient, but I think she's going to die." He came upstairs with me, looked at her and her chart, grabbed the bed and rolled her to the ICU himself. I have no idea how the conversation went between the cardiologist and her doctor, but it turned out she didn't have a broken back. She had an aortic aneurysm. That was the cause of her pain, low blood pressure, and loss of consciousness. She died the next day. Doctors, if a nurse says something is wrong, it's worth seeing the patient in person rather than shouting orders through the phone. Story 29. When I was about 10, red spots started appearing all over my legs, quite a lot of them. My family took me to the hospital and they immediately diagnosed me with an extremely rare disease, claiming my veins were bursting and that I had about 2 weeks to live. I stayed in the hospital for those 2 weeks, receiving extremely high doses of antibiotics. No one told me anything. My parents would visit crying, but they were allowed only about 30 minutes a day since I was on a special ward. Fast forward to my birthday, 10 days in. My parents convinced the doctors to let me celebrate one last time, and my family threw a big party with lots of my friends. While running in the grass with a few other kids, I accidentally stepped on a bee. Since I'm slightly allergic, it got serious, and we rushed back to the hospital. I could hear the nurses screaming at my family something along the lines of, "Now you've done it. You killed your son." That day, I received even more injections and IVs while everyone expected me to die. At this point, my aunt, a doctor in another country, became extremely suspicious. She arranged for another diagnosis at a hospital outside the county where the doctors were more competent. It turned out all those red spots were just allergies. 3 days later, I was out of the hospital. My family was furious with the staff. I think a few of them even lost their jobs. For me, those 2 weeks of high-dose antibiotics completely wrecked my immune system. And for the next 4 to 5 years, I would get severe colds and illnesses. Story 30. Not a doctor, but I witnessed one of the biggest medical mishaps ever. My sister is very tall, very thin, and extremely fit. She was in preseason for her WNBL season, running moderate distances when she suddenly felt a sharp pain in the left side of her chest, radiating into her arm along with shortness of breath. She called an ambulance and was rushed to the hospital. They ran all the standard tests, ECG, monitors, the whole beep-beep routine, and determined it wasn't a heart attack. They told her she had torn a muscle and sent her home. A week later, she was still in pain and swore she could hear a hissing sound in her chest. She went to see our GP. He listened to her chest, had her breathe in and out, and said, "You've torn your lung." My sister was a textbook candidate for a torn lung, tall, thin, and fit. The GP was amazed the hospital hadn't detected it. How do you miss a torn lung in the perfect candidate for a torn lung? Thankfully, we live in Australia, so she received the care she needed at no cost. Story 31. Not a doctor, I'm the patient, but I'm in the middle of this and I don't yet know how it will affect me. Still, it's concerning. I started having new headaches. I've had headaches my entire life, which even led to a codeine addiction. 3 years clean now, hooray! Anyone with chronic idiopathic headaches, or chronic pain in general, knows when a pain feels different, and these were definitely new. I went to my local GP. They're free, but most of them are rushed and don't really dig deep. I got one of those. He basically said, "I used to be a physiotherapist, so I think this is muscle pain. Get some physio and work on your posture." I've worked on my posture for years due to chronic headaches, to the extent that coworkers have asked if I was a dancer because I hold my spine so erect. Hilarious, since I'm obese. I didn't think posture was the problem. And you know the saying, when all you have is a hammer, everything looks like a nail? I didn't trust an ex-physio diagnosing me without asking where it hurt, what it felt like, or whether it was new. So I planned to get a second opinion. I got lazy and didn't go back to another GP. But I did go to my optometrist for my annual checkup. She took one look at my imaging, ran additional tests I hadn't had before, and referred me to an ophthalmologist. She looked genuinely worried. When I asked why, she said, "Have you recently started having headaches on the right side of your head, behind your ear?" I said, "OMG, how did you know?" She told me I had a retinal hemorrhage in my right eye. 2 days later, the ophthalmologist confirmed the hemorrhage. Further tests revealed I'm a glaucoma suspect and referred me for an MRI. The MRI, done a month later, showed a brain aneurysm. It's small, only 6 millimetres, and my blood pressure is normal, but it's pressing on my optic nerve and affecting my vision. When I went back to the first GP for a diabetes test, since obesity is correlated with glaucoma, I took great pleasure in telling him about the retinal hemorrhage, increased intraocular pressure, glaucoma suspicion, and the aneurysm. His response, "Oh, well, I suppose that might be causing headaches." Now I'm waiting to see a neurosurgeon in April, the earliest appointment I could get. Fingers crossed that addressing this aneurysm will help with these new headaches. In the meantime, I'm taking steps to manage my weight and overall health. Story 32. Like many others, I'm not a doctor, just someone who's been screwed over by quite a few. It all started with an infected hangnail. I went to urgent care, got a shot of antibiotics, and a prescription for another. I took the pills for about a week out of the prescribed 10 days. On day 7, I was in my chemistry class, last period of the day, when I started feeling extremely lightheaded, exhausted, and so dizzy I could barely see. I staggered down the stairs to the school nurse, but she was out to lunch. I didn't know what to do, and since I already had bad attendance due to chronic illness, I decided to tough it out through the next class. When I got home, I passed out on the couch. For the next 2 days, I was a mess. I spiked a 104-degree fever. My throat was swollen and lumpy. I drifted in and out of consciousness, vomited, coughed nonstop, and was so dizzy I could barely stand. That night, my family took me back to urgent care. The doctor there told me that my fever wasn't treatable, said I had an untreatable upper respiratory virus, and sent me home, insisting it wasn't an allergic reaction since I'd already been taking the antibiotic for a week without issues. The next night, I felt even worse. I couldn't keep food down, could barely breathe, and the dizziness made standing dangerous. A rash had started spreading from behind my ears down to my stomach in red blotches. This time, we went to the ER. The doctor there barely even looked at me, wouldn't touch me, wouldn't do a real exam. He glanced at the rash and said it was measles, gave me nothing for it. Said again that it couldn't be an allergic reaction to the antibiotic, then sent me home. By the next morning, I was desperate and went to see my primary doctor. They squeezed me in because of my symptoms. The assistant taking my vitals listened to my story and immediately said, "You're allergic to that antibiotic." She wrote it in my chart. Then a nurse practitioner came in, heard my whole ordeal, and said the same thing, that I was having a severe reaction, and it was already in my system long enough to become dangerous. He also wrote in my chart to never take that medication again. Finally, my doctor came in, confirmed everything, and told me flat out, "You're lucky. If you ever take that antibiotic again, you'll probably die." So, no, it wasn't measles. It wasn't an untreatable virus. It was an allergic reaction that 2 urgent care doctors and 1 ER doctor completely ignored. Story 33. Not a doctor, but this happened to my mom. My dad had dementia and was basically nonverbal, except for repeatedly saying my mom's name. One day, he called me. We had all the big speed dial buttons programmed with my number and kept sobbing her name over and over. I assumed there was an emergency, so I called 911 and asked them to make sure they took Dad with them if Mom had to go to the hospital. Then I headed over to their side of town. The paramedics called on the way and told me which hospital they were going to. When I arrived, the staff were in the process of discharging my mom. She couldn't speak or stand. Dad was running around like a scared toddler. The staff told me the ER wasn't a respite care center and that I couldn't just send my parents there when I needed a break. I insisted something was seriously wrong. She had been walking, talking, and driving the day before. Clearly, this was not normal. The hospital decided to run some tests and discovered she had sepsis. She ended up in the ICU for a couple of weeks. Story 34. Not a doctor, but I experienced the worst first opinion from a local GP. A few years ago, I started having unusual pains in my back, nothing like regular back pain. I decided to see a doctor since it was completely new. He felt around and simply said, "You must have strained your back. There's no problem." That night, I woke up shaking so violently that I had to crawl to the kitchen just to get a drink of water. I'd never experienced anything like it before. After about half an hour of shaking, I eventually fell asleep and booked another appointment with the doctor the next day. Once again, he insisted nothing was wrong and said the shakes were probably a panic attack. For the next 2 days, I experienced sporadic shivers and continued back pain. Eventually, it wasn't subsiding, so I went to the ER. It turned out my temperature was 39.8 degrees high, and the panic attacks were actually severe fevers. The back pain was actually kidney pain. I was diagnosed with a kidney infection and needed about 5 bags of fluids, along with a round of antibiotics. Safe to say, I left a very harsh review on the doctor's page. Story 35. Not a doctor, but here's a short story from when I was stationed in Germany. In the Army, we have to get periodically tested for HIV. One of the guys in my unit got tested after returning from Afghanistan. Much to his despair, the result came back positive. Naturally, he freaked out, and so did his wife. She assumed he had cheated on her, and understandably, this tore his life apart. He went almost completely through the process of moving to a duty station with proper medical facilities to manage HIV. Meanwhile, he was going through a divorce, his career was essentially over, and he was facing the prospect of living with an incurable disease for the rest of his life. As part of the final steps in relocating, he was retested, and the result came back negative. His first test had been a false positive, but by the time they caught it, his life had already been shattered. Story 36. Actual doctor here. A patient was sent to the ER with a diagnosis of toxic shock syndrome from their nurse practitioner. The NP called ahead, emphasizing how seriously ill this kid was and requesting immediate attention. Kid shows up, and it's scabies. Not even close to toxic shock syndrome. I had the patient evaluated and sent home within 30 minutes. Of course, I called the NP back and explained what toxic shock syndrome actually is, including its causes. The girl hadn't even been asked if she used tampons, a key factor in TSS. I advised the parents to switch to a different provider, ideally an MD or DO. Story 37. This didn't happen to me, but to my friend. In high school, my best friend developed extremely severe abdominal pain, so bad she was vomiting. She went to her GP, who just gave her anti-cramp medication and painkillers, telling her it was probably pre-period cramps and to sleep it off. I was telling my mom about it at dinner, and she frowned. She said, "That GP is an idiot. Call your friend and tell her we'll be there in 10 minutes to take her and her mom to the hospital. It's most likely appendicitis." My mom, who is the head of dermatology, called the ER ahead so they could prepare scans and lab work. We picked up my friend and her mom, drove them over, and the hospital did several hours of scans, ultrasounds, and blood tests. It turned out she had a 6-liter cyst in her abdomen. It was so large it had begun pushing her organs out of place, causing the severe pain. They rushed her into surgery immediately. If it had ruptured, it would have been fatal. Story 38. Not a doctor, but I've had several horrible experiences with medical care. The worst was when a physician's assistant consistently told my mom she wasn't sick for 2 months, refused to give her antibiotics, and almost caused her death. She had an abscessed lung completely filled with fluid, caused by pneumonia so severe that even the doctors weren't able to identify the bacteria or how she got it. During those 2 months, my mom was sweating bullets with a temperature over 102 degrees Fahrenheit daily, but the physician's assistant didn't take her seriously. When they finally did, her x-ray was so bad they thought she might have lung cancer. Why did this happen? Their thermometer was malfunctioning. It kept reading 98.3 degrees Fahrenheit, while our cheap home thermometer showed up to 103 degrees Fahrenheit every day. Each time, they sent my mom home, insisting nothing was wrong. We only got her correctly diagnosed just before she went into sepsis because we brought our own thermometer to the office and demanded they use it instead of theirs. I don't know exactly what happened, but I do know that the physician's assistant no longer works there. As of the week, my mom was rushed to the ER from their office. Story 39. When I was 18, I was pregnant with my first child. I went through a midwife clinic. That had a backup doctor. I only had to see if there was an issue. Well, one of my pap results came back abnormal, so I was sent to the backup doctor. He ran some tests and told me I had uterine cancer, and that I would need a total hysterectomy immediately after giving birth. I was young, scared, and exhausted. Over a few more appointments, we discussed a general plan for the surgery after delivery. When I gave birth, everything seemed fine. The doctor never showed up. Only the midwives did. After going home, the doctor's office called to schedule a pre-op appointment. In my panic and exhaustion, I told them I wasn't doing it and not to call me back. They left another message warning that the cancer would spread and that I would never be able to have another child. I didn't follow up again until 2 years later, when I returned to the midwife clinic because I was pregnant again. They sent me to a new backup doctor for my initial appointment. He ran all the necessary tests, and it turned out I never had cancer. It turns out the previous doctor had a tendency to recommend hysterectomies if he assumed a patient would be a drain on the system. Despite all this, I went on to have 3 healthy children with my then boyfriend, now husband. The only assistance we ever had was during the pandemic, when I was on unemployment. Story 40. When I was 14, I was an avid soccer player on my high school varsity team. During a scrimmage, I hyperextended my knee while trying to stop myself and crumpled to the ground. My knee couldn't support me at all. I tried to walk it off, hoping the pressure would subside, but it bent in directions it wasn't supposed to. When my mom came to pick me up, I told her we needed to see a doctor. She took me to a doctor I hadn't seen before. I explained that I could feel the bones in my knee grinding, and sometimes it bent abnormally when I walked. When he asked if I was in pain, I said no, but it felt like immense pressure all around my knee. The doctor told me I had a pulled muscle and implied I must not have had one before. I looked him dead in the eye and told him I knew it wasn't a pulled muscle. My mom, embarrassed, refused to get a second opinion. She basically gave me an ultimatum: either keep playing soccer or go home after school, but she wasn't taking me to another doctor. A couple of months later, after taping my knee for every practice and game, it swelled so much I couldn't wear jeans, only sweatpants. My mom finally agreed to see another doctor. He ordered an MRI, which revealed a torn ACL. Because I had been running and playing on it for months, my cartilage was also severely damaged. I eventually had surgery, but my knee still isn't the same to this day. Story 41. I was almost a victim of a misdiagnosis when I was 9 years old. One day, I suddenly felt the worst pain I had ever experienced in my stomach. I couldn't walk. The next day, I couldn't eat or drink anything because I would immediately throw it up. We went to a doctor who, after a very brief examination, diagnosed me with an intestinal infection. He prescribed antibiotics and sent me home. The antibiotics didn't help, and I kept getting worse. I became so weak that I could barely speak or move. Finally, we went to another doctor who recommended a sonography. When the results came back, we learned I had appendicitis, but it was too late. My appendix had already ruptured, my entire body was infected, and I was literally dying. I underwent a long surgery and survived, but the doctors told my family I had only been hours away from death. Story 42. I have a genetic condition that causes my stomach to be lined with polyps. For years, I complained of constant pain, nausea, and never feeling full. I saw multiple doctors with the same complaints, and each one told me that the polyps were the problem and that there was nothing they could do. The pain kept getting worse, and I was missing work due to frequent vomiting. Finally, I decided to try one more doctor. When I met with him, I brought a list of every possible stomach test I could think of and told him I wanted to run all of them. He agreed to perform some of the tests. One of them measured how fast my stomach was processing food. The test normally takes 4 hours, but I was done after just one. My stomach was emptying extremely quickly, a condition called gastric dumping. The symptoms made perfect sense: pain, nausea, and never feeling full. Now, just 2 pills a day have made a world of difference, and I'm finally feeling fine. Story 43. My second child was delivered via C-section. Afterward, a home healthcare nurse visited me daily to change my bandages. One day, she placed my bandages in a Ziploc bag and showed them to me. They were almost rainbow-colored. She told me this was a sign of a Pseudomonas infection and advised me to take them to my doctor immediately. I did, and the doctor started me on infusion therapy. I had to visit the infusion lab every day for 2 weeks to receive IV antibiotics. With my next pregnancy, I experienced spotting, again with the same unusual colors. I told my new doctor, but she did not investigate. She merely shrugged and said it was ubiquitous, everywhere there's water, and took no action. That pregnancy was very difficult, and while I cannot directly attribute all complications to Pseudomonas, I now recognize that she was negligent. In hindsight, I should never have allowed her to perform my second C-section after witnessing her disregard for my health. Story 44. Back in 1999, my father-in-law fell gravely ill. After extensive testing, he was diagnosed with pancreatic cancer and given only months to live. The recommendation was to make him comfortable and prepare for the end. We sought a second opinion from another diagnostician. Same conclusion. Cancer. Terminal. Prepare for the worst. Then we consulted a third doctor, an older surgeon, quiet, grandfatherly, with a twinkle in his eye. He reviewed all the tests and told us, right in front of the first doctor, that it was not cancer. There was immediate consternation and argument among the doctors. The surgeon explained to me privately, "If it really is cancer, we can perform a Whipple procedure to give him 6 more months. If it's not, we'll know for certain." My father-in-law was unconscious, my wife distraught, and my mother-in-law inconsolable. I decided to proceed with the surgery. The operation was long and intense. Hours passed without any news. Finally, the surgeon came out smiling. It wasn't cancer. It was a severe infection from a burst gallbladder that had spread to the pancreas, mimicking cancer. Thanks to that decisive action, my father-in-law lived another 6 healthy years. Story 45. The most recent concussion I had about 4 years ago was absolute hell, and I've never been the same since. I constantly feel like I'm not fully present, like I miss parts of conversations, and sometimes I can't remember even the most basic things. Every day I feel slower and more forgetful, and it's left me feeling stupid ever since. Every doctor I've seen about my ongoing symptoms never really believed I still had issues. I'm pretty sure some of them thought I was exaggerating or faking it. So I've just dealt with it on my own. A few days ago, I came across a post on a subreddit where the OP mentioned having auditory processing disorder, APD, and described how it affects them. I was intrigued because it sounded so similar to what I've been experiencing. I looked into it and realized I have nearly all the symptoms of APD. I also discovered that roughly 50% of people who have suffered head trauma develop APD. I haven't been officially diagnosed yet, but I'm making an appointment with a doctor soon to discuss it. For the first time in years, everything suddenly makes sense, and it feels like a huge weight has been lifted off my shoulders. Story 46. Patient, not doctor. In my early 20s, I went to see my doctor about a weird rash on my arm. I thought it might be from switching shower gel or something, but the doctor took one look and sent me to a specialist immediately. I had capillary bleeds all over my arms, legs, stomach, and back. After some skin biopsies, the dermatologist told me it was a type of infection and would go away on its own. A couple of months later, the rash still hadn't cleared, and I had a miscarriage. The doctor told me it was because I was overweight and that it couldn't have had anything to do with the skin issue. After miscarrying a second time and developing open sores on my legs, I was finally sent to a specialist hospital. There, I was diagnosed with a rare autoimmune disorder that usually affects boys under the age of 10. By the time I returned to the doctor to hear my diagnosis, I was pregnant again. She was shocked. Apparently, there were fewer than 20 known cases worldwide of a woman carrying a baby to term with this disorder. She explained that my previous miscarriages were likely caused by the autoimmune disorder, and for the rest of my pregnancy, I was very closely monitored. I'm now case number 21. My child was born healthy and full term. Story 47. I was wrongly diagnosed with PID, pelvic inflammatory disease. One morning, I went to the ER with stabbing pain in my lower abdomen and blood in my urine. 2 interns began the intake interview while I was already freaking out. I had to repeat and stress several answers because one male intern was too shy to ask sex-related questions. I waited another hour before the doctor arrived and gave me a pap test, which showed I had a yeast infection. Without running any blood tests, she repeatedly told me I probably had multiple STDs and that the infection could be progressing. Another doctor or resident came in to stress how serious PID was, warning it could lead to infertility. I was crying, in pain, and exhausted. After the lead doctor left, I overheard her showing the speculum to her interns. They laughed, and one exclaimed, "Cottage cheese!" I left the room crying. That same day, I had blood drawn to check for STD HIV and received painful shots that left my arm sore for minutes. I spent about 10 hours in the hospital. The next week, the STD/HIV tests came back negative. I went to a more experienced doctor for a second opinion and told her about the initial diagnosis. She looked shocked and disapproving. That's all they did and diagnosed you with PID? It wasn't PID. It was a severe UTI and a predisposition to yeast infections. I'm much better now thanks to probiotics, but thinking about that ER experience still triggers me. That week of waiting for results was emotionally exhausting and incredibly stressful. Story 48. I was on the faculty at a teaching hospital when a young woman was referred to me for abdominal cancer. A few years earlier, she had endured one of the worst days imaginable. Her father had been shot while working at a convenience store 2 states away. While driving to see him critically injured, she went off the road into a tree, which left her paralyzed from the waist down. Tragically, her father did not survive. Back to her visit. The referring doctor believed he felt a very large abdominal mass, though it wasn't visible on the CT scan. When I examined her, I couldn't feel a mass either. She pointed to exactly where the doctor thought it was, and I realized that being very thin, he had actually been feeling her lumbar spine. The natural forward curve of the lower back, lordosis, had been mistaken for a tumor. I showed her this on the CT scan and was glad to finally give her a good day for a change. Story 49. I've spent basically my entire life in and out of hospitals, being born with multiple conditions that required ongoing treatment. A few years ago, I had an accident where my kneecap dislocated. After suffering multiple dislocations, I was referred to a surgeon. The first surgeon I saw was absolutely terrible. He walked in and immediately told me there was nothing wrong with my knee. He claimed I needed psychological help and even dragged me into radiology to show me my MRI. Back in the room, now in tears, he began to manhandle my leg. The pain was unbearable, and I kept crying. At one point, he pushed my legs to my chest and I couldn't take it anymore. All he did was throw his hands in the air, say, "I'm done," and walk out. A few weeks later, I saw a different surgeon. After proper tests, he explained that the tendon holding my kneecap in place had suffered extreme damage, which explained the repeated dislocations. When he performed the surgery, he discovered that the tendon was completely destroyed. I had been walking around without a tendon for 3 years. Story 50. I was in generally good health, but started having sporadic, intense abdominal pain. Eventually, it became unbearable, so I went to the ER. They couldn't find anything obvious, labeled me as drug-seeking in my chart, and sent me home with nothing. I left in tears, supported on either side by 2 friends. A few days later, I went back. They begrudgingly ran some tests, and finally a doctor came in and told me my only option was an emergency hysterectomy. I was 30. Unmarried, and had hoped to have children one day, so I hesitated. I asked how long I had to decide and whether I could call friends for advice. The doctor reluctantly said yes, but hurried me along, saying his shift was ending and he didn't want to stay late. Thankfully, I had wise friends who helped me get home. I was still in intense pain, so a doctor friend from the original hospital suggested I seek a second opinion. At the second hospital, the doctor suspected a tumor on the backside of my uterus, positioned in a way that made it hard to detect. She proposed a minimally invasive surgery with just 2 small incisions. I asked whether a hysterectomy would be necessary, sharing what the first doctor had said. She barely kept her face neutral. It was clear she was frustrated by the previous misdiagnosis. During surgery, they discovered the tumor was too large to remove through the small incisions. They closed me up and scheduled a second surgery, this time requiring a full C-section style incision to remove a tumor the size of 3 softballs. I weighed only 110 pounds and had a flat stomach, so the pain I'd been feeling was from my organs being compressed around the massive tumor. Thanks to that second opinion and a skilled team of doctors, the tumor was removed, and I am forever grateful. And so are my 2 amazing kids. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.